So today we're going to talk about medical induction techniques for pregnancy and talk about this web of where you might start, where you might end up, some different reasons for why you might start in one place versus another, and just dive into the details here. So inductions are very common for various reasons. Some might be a medical induction, like you have high blood pressure that comes up, you have signs of preeclampsia that happen, and then they would likely want to induce you sooner rather than later. Some other reasons for induction might be choice. Pregnancy can be super uncomfortable, or if you have a lot of pain, you might want to be induced as well. So there's those options as well. And so when we're thinking about inductions, there are several different places you could start. Oftentimes, if you have had birth before, given birth before, you might start in a different place for one reason or another. For example, here, if you've had a cesarean section, they won't use a cervical ripening agent on you. They might start you instead on augmentation, which typically is Pitocin. So keep that in mind as you're thinking about what your induction might look like, if that's something that might become an option for you. Hopefully, if you don't want that, it doesn't, but this is getting into the details here, which will help you make better informed decisions. So typically, if there are no major complications, an induction might start with a cervical or a membrane sweep. Typically, you're sent home after you have a sweep. And that intent is to irritate or stimulate the cervix, which then might help promote labor starting. Then, if that does not work or doesn't work as effectively as the provider might like or you might like, then you might go from here to here. And then it's a cervical ripening agent. Typically, it is Cytotec or Cervaldil, which can be given orally or vaginally. And that promotes softening and thinning of the cervix, which then promotes potentially labor occurring. Sometimes they do a few doses of this. If this is not throwing you into labor itself, which sometimes it does, then you would move from B to C, which is mechanical dilation if your cervix has not opened past a 3 or a 4. Usually go here. Typically this is a Foley bulb catheter or Cook's catheter, which applies mechanical pressure to the cervix and encourages dilation. Usually they fall out around 3 to 4 centimeters. So if you're already there from cervical ripening, then they wouldn't have you start there. Then if labor is still not happening, they would either move to augmentation or to artificial rupture of your membrane. So if they move to augmentation, then that is typically Pitocin. Some clients will try and use breast stimulation, nipple stimulation like pumping or with your hands instead of Pitocin first. But the goal of this is to strengthen contractions. So if you're not having consistent, strong contractions, then they would probably move to augmentation. If you are having strong contractions, but for some reason they're very irregular, you're not having as much progress as they would like, then they might move to artificial rupture of your membranes, which can also help stimulate contractions to happen more frequently by that baby descending in your pelvis. So they could go here and then here, or they could go here and then here. And that is kind of a full flow through induction of where you might start and where you might end. Note that not everyone will start here. Some people might start with mechanical dilation if they have had history of a C-section and go right to here. Some might start here and go here. Some people might start right away with Pitocin if it's a more urgent induction and go here. Some might just stay here. There's a lot of different things or ways that induction can go. Some people may start here and never go past a cervical membrane sweep because that's all they need. Some people don't have a sweep. They go here, then here. Just a lot of different options for you. You might go sweep to augmentation. You might go from cervical ripening to augmentation and skip this step. You might go from cervical ripening right into artificial rupture of your membranes, or they might rupture on their own. There are truly a lot of different ways that an induction can play out, but hopefully this gives you an idea of what your options are and might be during labor and give you an idea of how it might progress if you choose or